Young, Empowered and Healthy, otherwise known as Y.E.A.H, started in 2004 as an initiative of the Uganda AIDS Commission. Created for and by young people, Y.E.A.H reaches out to Uganda's youth to prevent HIV, unwanted pregnancies, and school dropouts. Using innovative and appealing communication techniques, Y.E.A.H has emerged into a sustainable, coordinated, and highly popular multi-channel communication initiative on HIV prevention in Uganda.
There are many organizations, CBOs, NGOs, ministries, all of them were talking about HIV prevention among youth, but they were not coordinated. And they asked themselves, what if we had to have a coordinated campaign with one voice and one funding? And Y.E.A.H came into being.
Over the last 7 years, Y.E.A.H has implemented various campaigns addressing underlying issues linked to HIV/AIDS, such as sexual exploitation or something for something love, multiple concurrent partners, violence against women, and alcohol abuse. Each of these campaigns emerged since research had shown that in Uganda, gender issues are root causes of young people's vulnerability to HIV.
You know, young people want something interesting, not boring. You must be able to present it in the language they understand, in a way they understand and appreciate.
Rock Point 256.
Welcome to Changing World. The award-winning Rock Point 256 radio serial drama is at the center and heart of the Y.E.A.H initiative. With national coverage in 4 languages on 16 stations, it is safe to say Rock Point is one of Uganda's most popular radio shows.
It's another episode of Rock Point 256. Welcome back. Now, last time, this is what.
Inspired by campaign topics, each season carries 4 storylines, each modeling a different health or social practice based on research.
Do not let the kids suffer.
Suffer. I'm taking my blood.
The findings show that when you do this, there's a high risk of getting HIV. When you do this, you reduce HIV. When you have safe male circumcision, you are reducing your risk of catching HIV. When you're not violent to your wife, then there's better talking, there's better communication between the two of you, and then there's less need for you to run away and sleep with someone else. So we look through all the characters we have in our village, Rock Point. And so we say, okay, that would be a very good character to protect her baby from catching HIV.
I want to know why she is the best candidate.
Then we start creating the story around her. How did she know that she has HIV? What is the relationship between her and the husband? Then we start to create the scenes that will comprise of the story.
Only 18% go to traditional midwives. The rest of them, they deliver with family members.
You require information about what sort of drugs or medicines that they're using currently. If it's about maternal health, what are the WHO guidelines or the Uganda Ministry of Health guidelines on breastfeeding, for HIV positive mothers, those kinds of things you absolutely need to know, because you don't want to be giving out wrong information.
Once the script is written and reviewed, it is translated and ready for production. This process involves over 400 actors and production staff.
We don't tell people, do this, this is bad, this is bad. We show them.
The success of the drama lies in the concept for people to relate to the characters' experiences, stimulating them to talk about the issues, and ultimately making choices based on their own realities.
I would listen to something from the show, then in the world it is there. So when they came to that section of alcohol abusing, then it's when I started realizing that I had to change.
As I was listening, I heard the story about Lillian, how she came into Solomon's house as Solomon was going to help her, and then he started to use her sexually. He was giving her necklaces, shoes, even giving her some small gifts like watches. I looked at it, I looked at myself, I said, why can't I remain in school? I study, I finish, then if I'm to get married, I got a good man and get married.
When I started really hearing about the Rock Point programs on radio, I was touched because the story they were giving was somehow related to what was happening into my life. Like the young married people, how they can live without violence in their homes, and the input the young people can bring in the community as far as violence against women is concerned.
Rockpoint has started people thinking and talking about issues and demonstrated what change could look like.
Yes, you will always get help. You will always get a way out.
Yes, and with that, listeners, we've come to the end of another exciting episode.
Thank you for joining us. Please keep those letters coming in every week.
Are you experiencing violence at home? Mixing education with entertainment, 293 episodes have been produced to date and broadcasted on a weekly basis. Using the same storylines, comic books illustrate how attitudes and behavior can change over time.
But at first, I was scared of telling people about my status. But after reading this book, it's like I gained confidence. So I don't feel like telling someone my status.
Behavior change is additionally reinforced by various other Y.E.A.H community participatory activities aimed at sparking interpersonal discussions among the youth. The string game quickly visualizes the sexual network in a community with instant eye-opening effects for the participants.
Okay, I learned that much as I was using condom to these ladies, they were again having other guys whom they were going with live. So in a way, if I don't use my condom properly, I can get exposed since they were not protecting themselves with the other guys.
The silent trigger video is another tool used as a discussion basis at youth centers all over the country.
Any wrong thing that is likely to happen to that very young person you have watched can easily also happen to you yourself. Yeah. So it really makes discussions flow.
Through interpersonal small group activities that reinforce the campaign messages and goals, Y.E.A.H has been able to reach more than 100,000 young people in 31 districts through the networks of partners.
Each of these organizations have their own particular networks, their people they meet. So instead of you as an organization trying to have parallel channels to reach young people, we've just had this partnership where we use the networks of those which are already in place.
And we have been working with Y.E.A.H very closely, and they have been supporting us with their IC materials, but also it improved on our programming. We got skills in how to program on issues related to adolescents.
Rethinking Drinking is one of Y.E.A.H's most recent campaigns. At a consumption rate of 19 liters per person a year, Uganda was ranked by the World Health Organization as a leading alcohol consumer worldwide.
Our experience has seen people coming and testifying. Someone says, I contracted HIV just because I was drunk for that single night.
Realizing that there were very few services on the ground to help people with alcohol problems, Communication for Development Foundation set up a hotline to refer their audience to. Thousands of people from all over the country called for counseling, and soon after, the toll-free number was shared on all campaign materials and has emerged to the National Health Hotline.
The Y.E.A.H program of targeting the youth, I think it's another interesting approach. Getting to a target audience using the channels and that appeals to them, and that's what they are doing.
And the success shows. Y.E.A.H has received 3 international awards for excellence in health communication.
So watch this, man.
Over the years, Y.E.A.H has successfully created a sustainable, coordinated, and highly popular platform for young people in Uganda and a better future.